Dr. Cooper.
Hi there, how's it going?
Good. Thank you so much for your time. We're really enjoying what you have to say to us and what you have to say about your new hospital.
Thank you, that's nice of you to say.
Yeah. So what can we look forward to for today's vlog?
Oh yeah, so oh hey Spud, quick that was quick today. They're missing out on some attention.
He brought us a
Brought a
toy.
toy
Oh,
and
two
everything.
toys. Hello,
It's so
sir.
clever. They've seen better days. Bit wet, thanks. Well then off you go. So today's vlog, I'd like to dive in a bit to preventative care, and so specifically today talking a little bit about vaccinations and actually more specifically feline cat vaccines, how we make decisions around that, and talk a little bit, provide an update on how the new hospital opening is going.
Can't wait for that.
Mustn't forget that. Just some preventative care in general. Maybe we'll explore a little bit on what I hope to share over the coming weeks on the vlog. So I'm excited to explore that.
Oh, thanks for setting us up with all that. That's great.
Of course.
Okay, so we're all dying to know, how's the new hospital coming?
Good. Yeah, I am. I've posted about it. I'm excited beyond words. So right now, it's a little bit strange when I walk in because there's stuff everywhere, like boxes and big pieces of furniture and those kind of things. So it looks a bit more cluttered, but essentially it's more finishing touches. We just had a really great company come in who fitted out the security and we'll be monitoring there. So everything's good because the safety of me, my team, the pets, the property is really important.
Awesome that you care so much about that.
Yeah, definitely a huge priority. So they've been working with us. And so, over the coming couple of weeks, we have some kennels to be delivered. We'll need those for sure. And then some of the final pieces of bigger kind of equipment coming in. And then, hey Spud, let's see what kind of mood he's in. And he's got this like gross wet green toy that he's rubbing against my leg.
So you go right ahead, Dr. Cooper.
So finishing touches really, aiming to be definitely on track for the grand opening event with Positive Difference on 1st of February. 10 a.m. to 1 p.m. 1st of February at 7920 North Decatur Boulevard. So we're hoping to see lots of people there. I've been connecting with some of the offices of like local communities and apartments, sent some emails out to local big members of the community like North Las Vegas Police Area Command. They do a really great community outreach program. Local, the local elementary school. So hopefully, people can come along, have some fun. If you have a dog or a cat that needs vaccines or a microchip, we'll be doing those at $10 each. It's just show up. There's no appointments.
Wait, let me stop you there. $10?
$10 per vaccine and $10 for a microchip.
Wow.
No appointment needed. Just show up. Now, hopefully.
That is an insane price.
Yeah, I think it will be hopefully make things really accessible for people, and hopefully we can get through lots of pets in the allotted time and we don't run out of stuff. If we do run out, I'm sure we'll give out a coupon for someone to come back and we'll still honour that. So we'll take care of that. But super excited, and hopefully there'll be some refreshments there. Hopefully we'll line up a hot cocoa stand and those kind of things.
Wow. So, I'll be there, and I'm looking forward to it. I know you mentioned preventative care. Can you tell me a little bit more about preventative care and what that means?
So preventative care, for me, was always kind of like the less glamorous side of medicine. But over the years and having seen some cultural differences, it's a little bit strange to me that coming from the UK, preventive care kind of lagged behind the US, especially with things like routine parasite control and yearly dentals and these kind of things, which really can maintain health and not wait for problems to occur. Whereas here, we lag a bit on pet insurance, and there's way more insured pets in the UK. So it was a little bit strange to me. Yeah. Yeah. So we're going to have a focus on both. Both are very important. But for the purposes of preventative care, there's probably 6 main kind of buckets for me there. The most common one that my mind goes to, I think most people know about, is vaccines. So for vaccinations, really the most valuable, well tried and tested thing that we've been able to do as a society, both on the human side back in the last century and when vaccines were really developed to help prevent infectious diseases. So vaccines, kind of the first big one. Parasite control. So people generally know that if they have a puppy or a kitten or an adult dog or cat, we need to treat them for parasites, whether it's on the outside of the body like fleas or ticks, or internally like parasitic worms. I'm going to keep track now. So that's 2. Another huge one, which is often forgotten about, but I would definitely class it as preventative care, is nutrition.
Yes.
We're gonna have,
you're big on nutrition.
because this is something that you do every day, right? Vaccines might be every 6 months or 12 months or even 3 years. Nutrition has a huge impact on your pet. The type, the amount, what we're doing for treats, and there's a lot of information out there. Like for me, it gets confusing, so I can only imagine what it's like for someone with a new pet. Like, where do I begin, basically? Vaccines, parasites, nutrition, dental care that we've already talked about. So maybe the routine yearly or 6-monthly exam versus actually a general anesthetic. Examine the mouth, x-ray the mouth to make sure there's no hidden problems that we can't see just with the naked eye, and then teeth cleanings and that kind of stuff.
So what is a general anesthetic for people that don't know?
So for us, general anesthesia would mean your pet comes in the morning, fasted but not for too long, because that can sometimes lead to some reflux.
Fasted means?
So no food from a certain time, the night before, the early hours in the morning, but free access to water. Okay. Very rare that we would hold water. And then they would get a blood test in the morning to make sure that everything is safe for general anesthesia, especially things like their electrolytes and their blood glucose, things that could cause an issue. And then an IV catheter is placed, and they're anesthetized, and then they're monitored closely by someone dedicated to monitoring the anesthesia, while another technician performs the dental assessment and cleaning and takes x-rays, and then I check in, much like when you go to the dentist. The technician does some of the things, and then we take a look, and depending on whether or not we find anything, we may be calling with additional recommendations, such as tooth extractions or placing an antibiotic in the mouth or something like that. Or we may be saying, great news, everything looks good, no further therapy aside from home care for 12 months, basically.
Wow. That is extremely thorough, and I love how you really detailed that for us, because I don't feel like everybody understands what that means and why they're paying that price for their teeth being checked.
Yeah, it's great to hear from a pet parent perspective, because often in the profession we take things for granted that everyone knows what we're doing. For sure. And coming back to the feline aspect, we'll also, one day a month, we will have a cat only day, because sometimes when the cats come in, they don't want to hear dogs barking and this kind of stuff.
That's amazing,
so sometimes we'll see Fluffy and she's like super happy, or he's super happy to see us, and then sits in a kennel listening to a dog bark for 20 minutes, and the next time we go to say hi to Fluffy, and not so friendly. So we'll be employing lots of fear-free and low-stress techniques in the hospital, and a future vlog sneak peek.
Yeah, that's tremendous. I'm a cat lover, so
I do know that.
Okay.
Where are we? Hold on. I'm glad you're counting.
Vaccinations. We've done nutrition, we've done dental, and we've done parasites.
Okay. So another big one is behavior. And this is not to be underestimated. This can make or break a family dynamic, whether it's a dog or a cat or even other species. And so in the comment section and in the post, I'll be sharing some references so that whilst people are waiting to see their vet or hopefully coming to see me at some point, you have some resources that you can look into. So things like Ohio State University, they have an indoor pet initiative geared towards cats, enriching their environment. There's some great resources online. I love Jackson Galaxy's Facebook page with he just great ideas, and he seems like a real genuine guy who wants to help people and their cats. So
all right, pause. Who's that?
Jackson Galaxy. So the guy on TV who has like a goatee and kind of doesn't have much hair, but maybe does
like
something
the
with it. Quite
chops.
flamboyant, colourful shirt. Yeah.
It's a show, right?
Yes, and a website and Facebook page.
Okay,
so I definitely.
So he's the real deal. He's not just faking his stuff.
So thanks for that. We're probably gonna. I like his content, and I think he's a good resource.
Yeah.
I have not been in and verified and validated everything that he says or does or sells or whatever.
He does not endorse.
This is not an endorsement. It's just something that I enjoy.
Okay, very good. All right.
So behavior it's just a really important thing, and so finding yourself a good system for that is, and you want to do it from early on. The plasticity, the ability to learn is huge, and I would say one consistent theme for dogs and cats that I see is like environmental enrichment, if that's in the house, for cats that are indoors, or taking the dog out for exercise, because they need to be mentally and physically kind of doing stuff during the day, and then they're going to sleep a lot and be more manageable.
So you'll have resources available for people that really don't know where to begin.
So I'm going to list some resources in the post and in the comments section, and we will, and they'll at least give people places that they can go until they can get to speak to their regular vet, or just it's kind of a conversation starter for you to go and say, hey, I saw this English guy on YouTube talking about X, Y, or Z, and what do you think about this? Because there's definitely areas where you can speak to 3 different vets and get 3 different answers, and that's okay as well. And then the final thing that I would put in preventative care.
May I ask another question about behavior, please?
Of course.
So you've mentioned one person that has, did you say Ohio?
Oh, Ohio State University.
Okay, so that's great. Are there other specialists in the field? Like, can a veterinarian train to be a behavior specialist?
Yep, there are definitely animal behaviorists out there, and they vary from animal trainers in terms of the level of knowledge and training, and so I will share the behaviorist website. Sometimes they can be a bit more tricky to find one in your area because it is more specialist. So for Spud, who was in here being naughty, great.
Show you
his toys. So Spud, who was in here showing off his toys, we're in Las Vegas. We're on the north side of town, so we went to Smarty Paws on Rancho and Craig, and he loved that. He loved the activity and interacting with the other dogs, and they did for us like a really great job with his training and helping us out there. So that was good. Yeah, and for a lot of things, I can't recommend anyone. I don't know all the trainers in town or Southern Nevada or Northern Arizona or anything like that. So I would generally say check with your friends, check on local Facebook groups or social media groups, and go by word of mouth. And I would go by kind of the positive things people are saying. Like, don't get hung up on the one kind of maybe negative review that's a bit out there when there's something else going on.
Absolutely.
All right, the final thing I would class this as preventative care, a microchip. It just when we have potentially a stray brought in and we're able to reunite that pet with their family, it's rewarding. It obviously helps animal control and the shelters and these kind of things. Or sometimes a really tough situation is if a stray gets brought in and they're injured. At least if they have a microchip, we can like talk about emergency care and these kind of things, versus a stray where there's no identification and they're severely injured, and we don't know if we can carry on, if we're ever going to find the owners, and they're suffering. Like sometimes that puts us in a really awful situation. Not that it's anyone's fault or blame. It's just if it's preventative, we should do it. And I think laws have been updated now to where if you have a dog or a cat, it should be microchipped.
I think I heard something about that as well. Okay, so I'm a pet parent. Let's pretend I'm new to you. Where do I begin?
So I think for me, I would definitely prioritize scheduling a routine appointment with your regular vet. So one of the most valuable things we can do as veterinary professionals is the physical examination. You know, we have in-house blood tests and x-rays and ultrasound and all those things, but none of them replace physically looking at and getting hands-on the patient in front of you. So I'd prioritize ideally getting them scheduled with the vet. In the meantime, nutrition, like we talked about, is huge. So maybe your regular vet can give you recommendations around a general food brand that they like and recommend. And generally speaking, I would lean towards a complete pet food by a reputable brand that has a lot of years of experience and research in making pet foods. We also, I would recommend cooked foods, and we'll come back to that a little bit when we're talking about the vaccines for cats, and something that is an issue right now for cats and could potentially be a risk with some uncooked foods.
Oh, I see. I can't wait to hear the episode where you talk about diet and nutrition in more depth, because there's so many brands out there. There's commercials that we see as pet parents. We think, oh, this is the best one. No, this is the best one. No, we need to do this one. And we just don't really know. So it'd be great to hear from you. And I know that you're passionate about nutrition, about keeping dogs and cats and all animals as healthy as possible. So yeah, looking forward to that.
Thanks. Yeah, we will have some definitely some discussion around it, and some of the tools that we'll be using in the hospital to help manage that. So I would check in with your regular vet, see what they recommend for nutrition. Generally, like I say, a complete food that's age appropriate for your species and possibly breed, and cooked is what I would recommend. And then your regular vets can also talk to you about all of the preventative care areas that we spoke about.
So we talked a little bit about cats, and you mentioned about cat vaccines. Was there something specific you wanted to tell us about that?
Yeah, I think that, so in terms of vaccine principles, it's important that we do the right thing to the best of our ability. So whether it's cats or dogs or other species even, first of all, we need to assess kind of history, lifestyle, and perform a physical examination on that patient. And then once we've kind of established risk, we can discuss, okay, here's the risk of being vaccinated and not being vaccinated, because occasionally we can see allergic reactions to vaccines, and that can range from a little bit of a swollen face, some hives, maybe a little bit of a tummy upset, all the way through to life-threatening anaphylactic type of reactions. And that can be, in cats, tends to be a bit more of a breathing respiratory issue. In dogs, it tends to be a bit more of a kind of liver issue. But either way is very serious. So we don't want to just be vaccinating every patient against everything if there's no real benefit to the vaccine, but there is a small risk associated with giving it. So just to kind of recap: history, lifestyle, thorough examination, and then we can make recommendations.
Wow, I wish my doctor was that good.
And then once we have that assessment, we can talk about the vaccines. And broadly speaking, we'd have core vaccines. So they are vaccines that we consider in this case, cat should be vaccinated against every time.
Okay.
And for cats, that would typically be calicivirus, which is kind of like a respiratory virus, a feline herpes virus, which affects a similar area of the body, mainly respiratory signs. Mainly respiratory signs. They vary a little bit in terms of how they present, but some cats get both, and it can be really difficult because they get so mucousy and snotty, and they can't breathe through their nose properly. They can't smell their food. And cats use their nose a lot when it comes to eating.
Sure.
So sometimes they won't eat to the point where we have to place like a feeding tube to get nutrition into them, because the signs can last for a while.
Yeah.
So we definitely don't want that. And then feline panleukopenia virus, which is another virus.
Mouthful.
Yeah, and that one tends to be a bit more that can be life-threatening, especially in smaller kittens. It can make their white blood cell counts drop down and can give them really severe GI signs, gastrointestinal signs.
Yep.
So they're the core vaccines, along with rabies.
Sure.
And rabies, we don't see a lot of it. But thank goodness, exactly. But if a cat or a person or a dog, for that matter, are infected with rabies, it's usually fatal. The vast majority of the time, we don't have good effective treatments. And we certainly don't want that becoming endemic in any population. So they're the core ones. Hi there, this is Dr. Cooper, and you are hopefully watching my vlog. Thank you for getting this far into it. The reason for my interruption, when I was recording the initial vlog and I was just doing the edit, I realized I forgot to talk about feline leukemia virus. So I figured I would add this bit now. So feline leukemia virus is a virus that can affect cats of all ages. However, kittens are more at risk to the virus, and also the risk of transmission is increased for cats that come across other cats with the virus, or outdoor cats as well. So feline leukemia virus is considered a core vaccine. We give the full course when they're kittens, and then booster vaccinations can vary depending on the risk. So apologize for missing that the first time round. Check out the comments for the link to the AAFP page where you can get more impartial information on feline vaccines. Thanks again for watching. Enjoy the rest of the vlog. And then we have lifestyle ones. So in cats, that would be chlamydia and bordetella, so more respiratory issues. And that's based on risk assessment, i.e. are these cats in a community or a colony where there's an active infection, and we may want to use vaccines as a strategy. But their effectiveness is not 100%, and so it doesn't make sense to vaccinate every cat who's low risk of exposure with that. And then there is also a virus called FIP, or feline infectious peritonitis.
Another mouthful.
And lots of long words in there. And this is not related to COVID, but is a coronavirus. COVID is a coronavirus. And occasionally it can cause very severe disease in cats. There is some treatment. We're not getting into that right now, but FIP we didn't used to have treatment for. We do now in some situations, which is great. But the vaccines typically, by the time they're licensed to be administered, kittens are already carrying the virus, and then the strain of the virus that we believe causes the really bad FIP is not included in the vaccine. So that one is currently on the list of not recommended, because we don't have good data that it works well. And as we mentioned, any vaccine we give, there's a small chance of an allergic reaction, so it doesn't make sense to give that. And so, preventative care is huge. Vaccines was the first thing we talked about, and core versus non-core or lifestyle vaccines. And at the moment, and as we've experienced over the last few years, there will be emerging diseases as well. For about the last 11 months, the US has been kind of battling a pathogenic influenza virus. So that is in multiple species. So it's highly pathogenic influenza virus H5N1. Sometimes it will crop up in the news and things. So is typically, if you come across it, there's a high chance it's going to make you sick to a varying degree. And this is the virus that, if you've read in the news about large populations of wild birds dying off, it could have been, or most likely was, an H5N1 outbreak. So reasons we're concerned about it at the moment are cats can be a host of that virus as well. And unfortunately, the infection is relatively rare, which is good. But when it does happen, it's often fatal. And we don't have specific treatments for that, and we don't have a vaccine for it.
Right.
The other thing, if it jumps from wild birds to cats, is cats sometimes exhibit, or reasonably frequently exhibit, neurological signs. And it can be difficult to tell the difference between that and what could be rabies.
Oh my gosh.
And unfortunately, if animal is concerned, if we're concerned that an animal has rabies, we have to test for that, and that's not a pleasant thing. Yeah, because someone has to look at the brain down a microscope, which means the animal can't be alive and the brain has to be taken. And that can be really difficult. There was a story shared recently of a Good Samaritan adopting a stray kitten, and the kitten was fine when they adopted it, and then went on to develop neurological signs and did actually have rabies. And so there was a whole that was terrible for the kitten, and then people that were exposed to that. So for now, we want to try and limit cat exposure to the virus. Ways it can be transmitted: wild birds. So sadly, if you do have an indoor-outdoor cat, having them inside is preferable. Going back to the behavioural side of things, that's something where you would need lots of environmental enrichment because they're not used to that. Other ways that the virus could survive and get to a cat would be raw meat. So for nutrition, that would be one of the reasons why at the moment I would recommend a complete cooked pet food. And then other things would be unpasteurized or raw milk or colostrum. So certain cats, like maybe on a farm or something like that, would be way more at risk. And so, just something to kind of be aware of. I'll share some resources around the influenza, the rabies. There's a website called, I think it's Rabies Aware, and you can search by state as to what the requirements are, because in Nevada, your dogs, cats and ferrets must all be vaccinated against rabies.
Wow. That was so much information, and I love all of it, and thank you for that. I have a question. So you're extremely knowledgeable about lots of things, clearly, but you just gave me a ton of information about vaccines and cats specifically. How do you keep on top of it? Because it sounds like it's ever changing.
Oh yeah, good question. So so hopefully this vlog, you can kind of watch it, and as I mentioned, it might stimulate conversation or just give you a little bit of an insight into what me or other vets may be thinking when we go from you arriving and saying hi, checking your baby over, to giving a vaccine. There's a lot that goes into that. But in terms of when we actually make that final decision, there are some great resources as well. The two that I use most commonly is the American Animal Hospital Association, or AHA. American Association of Feline Practitioners, AAFP. And they have panels of experts who review the literature and then make recommendations on, if you have a dog or a cat and they are this old, what should we vaccinate against and what should that schedule look like, basically.
I'm assuming, in addition to all of that I'm assuming you stay on top of, because it sounds like you do. I would also assume that you do a lot of continuing education.
Yes, one of my favorite things to do. And so the field, I mean, in certain areas advances rapidly, and there are new products coming out, and like we talked about, emerging diseases. I am USDA accredited, so that means I can assist you and assess your pet and help with paperwork if you want to travel with your animal, well, your dog or your cat. But as part of that, there is an entire community and field of vets who are really assigned the responsibility, or have taken the responsibility to help protect public health through assessing livestock and wildlife and these kind of things. So yes, continuing education, we have to do a certain number of hours per year to keep up our licensing anyway, because the profession does evolve quickly, and whilst some things stay the same, lots of things don't, and we want to keep up with that.
Absolutely. Okay, so we talked about a lot of stuff.
Yes.
Thank you for all the information, Dr. Cooper, and I think it makes all of us very excited to hear what you have to say next, because I think that you have so much information to give the masses, and you're giving it out for free. Like, how cool is that?
Hopefully, yeah. I mean, there's the pets are always going to need vets, and preventative care is huge. So this information, I would love to have it kind of in one spot where people can reference it. There'll be a disclaimer in the comments. Disclaimer now, like, I'm not giving out veterinary advice. I can't recommend any specific therapies or treatments or diagnostics or make diagnoses on your specific pets, but we can talk about general principles and what I do in my practice. And yeah, I think that should be out there, and like I say, I think hopefully at the very least it stimulates conversation, and hopefully if there's a little bit of knowledge out there as well, then that will benefit the health of pets.
Absolutely fantastic. Once again, Dr. Cooper, you have come to the table and given us your full service veterinary care.
Thank you very much.
We appreciate it. We love you, and we look forward to seeing more.
Thank you very much.